program coordinator. I'm the program coordinator working on the Unchained Kentucky campaign. I reside in Colorado, but Kentucky has a special place in my heart as I have been to treatment there myself. I am a person in recovery for 8.5 years. So Unchained Kentucky is a webinar series that is in partnership with the Kentucky Opioid Response Effort and Shatterproof. We're going to give a special thanks to Kelly Sanchez for her ASL interpreting today, and Lisa Colston and Chuck Larson for the closed captioning services that are being provided. So I'll be providing a brief overview of the Unchained Kentucky campaign, what our approach is, and then we'll be moving along into our presentation. Unchained Kentucky is an evidence-based behavior change intervention. It's aimed to reduce the addiction-related stigma held by Kentuckians. The campaign is delivered by our organization Shatterproof, which is a national nonprofit committed to ending the addiction crisis in the US. This is in close partnership with CORE, which is the Kentucky Opioid Response Effort. And this project is supported by CORE through a SAMHSA grant. The intervention has 3 main objectives. So we want to increase knowledge about opioid use disorder and that recovery is not only possible, but probable with proper support. We also want to improve attitudes towards those living with and or in recovery from opioid use disorder. And lastly, develop Kentuckians' understanding of the disease so people can better support loved ones with opioid use disorder. So a lot of people ask, what does evidence-based mean? How do we do this? So we have a 3-pillar approach. The first one on the left, you'll see is community connection, which is super important. We partner with community-based organizations across the state, and we conduct needs assessments with some of them. This will let us know the areas we need to address. We also have a community impact committee made up of people who reside in the state. They help give insight and keep a pulse on the campaign. They look at the areas we are hitting, where we can improve, and how everything is being received in the state. Second, you'll see there is story sharing. This is super important in our campaign because we're putting a face to the disease. We interview people who are in recovery, people who have friends and family that they've either lost the disease, are in recovery, or in active addiction. And lastly, we interview treatment providers and staff who work in the field. These stories make a connection between those affected and the general public, which is increasing empathy and understanding. Lastly, you'll see on the right is our education component. We do this through these webinars. They help us use knowledge from our community-based organizations and knowledge from communities to figure out what are the exact messages we need to be putting out. And then we create webinars on these topics to help educate the general public. So this is just a brief overview, and my email, if you have any questions, is ariley@shatterproof.org. You'll see it at the end of the presentation, and also you can see it on our website, unshamedky.org. So I'm going to be giving the event description, and then I'll be introducing our moderator. So this month's Unchained Kentucky webinar explores different roles within and outside of the carceral system and how these roles have helped current and formerly incarcerated individuals. This panel will bring a diversity of perspectives from peer support and lived experience in the carceral system to legal aid and re-entry services to help those in recovery. This presentation will be of interest to community leaders, healthcare providers, social service providers, policymakers, and anyone interested in how to better serve individuals currently or formerly impacted by the carceral system. We have 3 learning objectives from this webinar. The first is to discuss the benefits of peer support services within the carceral system, look at the barriers to recovery and treatment for incarcerated individuals, and lastly, to connect attendees with resources for those currently or formerly involved in the carceral system. So now I'm going to introduce our moderator, Caroline Irizarry. She is currently the Senior Director of Community Health and Forensics at River Valley Behavioral Health. This is a role that involves developing and implementing strategic initiatives for community health programs and serving as a liaison for forensic services to decrease stigma and increase engagement in behavioral health services for better health outcomes. This includes engaging in collaborative measures with first responders and judicial entities to decrease stigma and increase awareness of mental health and substance use related issues in collaborative processes. She has served over 22 years working for the Department of Corrections with diverse justice-involved populations, facilitating behavioral health and rehabilitative services through various programs and interactions with internal and external stakeholders. She advocates for rehabilitative process and community engagement for justice-involved individuals with mental health and or substance use issues in their journey to hope, resiliency, and recovery. Caroline currently serves as a member of the Regional Reentry Intercept Collaborative in Western Kentucky and a Community Impact Committee member of Unshamed Kentucky. So I will be passing it over to Caroline now to take over and introduce our other panelists.
Thank you. Thank you very much, Ashley, and thank you for all the wonderful work that Unshamed Kentucky is doing across Kentucky. We're hoping we're sending out the positive messages and decreasing stigma along the way. Want to introduce Stephanie Flannery. She's one of our panelists. Stephanie Flannery is a directing attorney director of tax clinic at Apple Red Legal Aid. She works as a legal aid office that is committed to providing fresh start to those in recovery. The attorney at Apple Red are committed to helping individuals in recovery with civil legal needs, including helping with expungement, bankruptcy, public benefits issues, divorce custody matters, and federal tax issues. Thank you, Stephanie, for coming in and participating in this webinar with us. We also have Miranda Nelson. She's one of our other panelists. Miranda Nelson is a recovery coach and adult peer support specialist, APPS with Voices of Hope. She is currently placed at Kentucky DOC facility and substance abuse programs, which is the SAP. She works alongside participants who are in recovery, like herself. She works towards the sharing of experience in justice settings and addiction services to better help fight stigma to those of us who those who are in recovery or currently in active addiction. She is knowledgeable about the potential barriers she has noticed during her time as a recovery coach and APSS that have been a struggle for many participants. She wants to help improve and remove recovery barriers so that those who are in recovery can have more supports to better his or her own recovery pathway. Each individual in recovery has their own pathway. No one recovers the same, which is a very important element because each person is an individual. So thank you both for participating in this panel. So I want to see if you could tell us a little bit about yourself and your organization. Tell us about what you do. Stephanie, if you can go first, that'd be great.
I think she summarized what I do here pretty well. I am an attorney working at Apple Red Legal Aid. I've been here for a little over 20 years now, and I do pretty much, or have done pretty much all that we do, which is provide civil legal services to low-income Kentuckians. We do have a new grant that I'm proud to talk about, which is our Project for New Grant. So we will have attorneys throughout our program that will be specifically meeting the needs of those in recovery. And we're excited about that. But I have never had that position myself, but I've had the pleasure of working with many clients who are in recovery. So I can talk a little bit about that if you'd like. I like to say that here in the Richmond office, we have been working on giving those in recovery a fresh start. So we go out to recovery centers and talk about how bankruptcies, divorces, expungements, and federal tax relief can give them a fresh start on life and how Apple Red can help them achieve that.
Well, thank you. And thank you for everything that you're doing for the recovery population. Sorry, Miranda, go ahead.
Hi, I'm Miranda. I'm a person in long-term recovery for over 3 years now. I'm a recovery coach and adult peer support specialist with Voices of Hope in Lexington. Under the Department of Corrections project, I currently chair smart recovery meetings inside my facility, and I provide support for participants and help find resources for them in their community.
Thank you, and thank you for participating as well. So now that we're talking about justice involved individuals and in the area of recovery and services and how that kind of barriers can exist and issues can exist, can you describe an inspiring moment that of helping someone and how it impacted your view on incarcerated individuals? Stephanie, if you can go first.
We don't work with a lot of incarcerated individuals here at Apple Red, but I've certainly worked with many who have been recently incarcerated who are in long-term recovery in our community. We do have some grants that allow us to go into work with incarcerated individuals, but we can't do any long-term litigation for them. So we help get birth certificates, help them understand what the expungement process is. And in my role as the tax clinic director, I've been able to help quite a few incarcerated individuals obtain their economic impact payments that they didn't receive back in 2020 or 2021. But as far as inspiring moments for those in recovery, I've had the pleasure of being able to represent parents who have lost contact with their children, who've gotten their life in a different place and who are now ready to set up visitation. And I've been able to go to court with them, ask the court to grant visitation, and to be able to watch that go from being supervised at the beginning to develop into a long-term relationship where they're getting the same visitation rights as all other parents once they've shown the court that they are no longer addicted to any substances and that they want a relationship with their children. The courts seem to be coming more and more around to providing what I call grace to individuals and understanding that they are in the same situation. They want a relationship with their children and working their way up to having 50-50 equal time sharing with children. I also had the pleasure of doing a lot of expungements, and I would actually say those are probably among the most inspiring moments because I've been able to help people who are way past short-term recovery. They're definitely in long-term recovery because, as we'll talk about in a few minutes, expungements are 5 years after your last criminal charges have been resolved. And I've been able to help people get rid of felonies from their records and then go on to school and pursue dreams that they've had for a really long time. So that's been very, very inspiring work for us that we're really happy to do.
Thank you.
You're welcome.
I guess an inspiring moment for me is anytime I get to help another person who is incarcerated and in recovery. When my participants come to me wanting support or they're wanting resources and they utilize those resources, I feel inspired because it is difficult to reach out for help sometimes, and it feels rewarding and humbling at the same time.
Thank you. Stephanie, and the expungement, what do you think describes the process of expungement?
Okay.
And how can it make it a difference? Sorry.
Yeah, I'll try to kind of summarize how that works. The first step in an expungement for any of you giving advice to individuals is that they have to obtain a certificate from the Kentucky State Police. So that can be done real easily online. You literally can just Google expungement certificate Kentucky and it'll come up with a link that'll take you to the site where you order a certificate. Once the certificate comes back, it'll be good for 30 days. So it isn't valid for very long. So it's important once a person has that certificate that they reach out to a local legal aid organization, which covers the entire state. So there's a legal aid in every single county in Kentucky willing to help individuals with expungements. So they take the certificate to their local legal aid and they will help them file the petitions. They'll help them file motions to waive the fees, et cetera, et cetera. So the certificate itself will say yes or no as far as what charges are eligible for expungements and which ones aren't. And of course, as attorneys, we can explain why some of them may not be. But it's important for everyone to understand that you have to be 5 years out from the last time there were any issues with a criminal charge, meaning the last time a fine was paid, the last time you were, like when you complete any restitution you were ordered, or when you were incarcerated and you're out, or if you're on probation, it goes 5 years from when your probation was complete. So it isn't just 5 years from when you were charged or 5 years from when you were convicted, but it's 5 years from when the charge was completely resolved. So after that, you can get convictions taken off your record. The good news in Kentucky is just recently, as of this summer, you can have more than one Class D felony removed. So we can now expunge numerous felonies. And of course, all misdemeanor, not all, that's a blanket statement. The majority of misdemeanors are eligible for expungement, and all dismissals are pretty much eligible for expungements. There's no cost for dismissals. They're free. It's $100 per misdemeanor conviction, and it's $300 for felony convictions. But the courts are really good about considering waiving those fees. And Goodwill Clinics has become, well, Goodwill itself has been sponsoring clinics throughout the state, and they're very invested in helping individuals with expungements, and they are helping to pay those fees for individuals who attend their clinics. So anyone who comes to us and says, hey, I have some convictions in my background, we want to do an expungement, we refer them to a Goodwill Clinic so that they can get those resources to help them pay for their certificate and to pay for the fees that are involved with filing a case.
Okay, so again, they can only file that after 5 years post payment of all fees and anything related to the conviction itself, correct?
Right, and I want to make sure I'm clear, like if someone gets a speeding ticket or some kind of traffic violation and they have to pay a fine, that's not going to prevent the 5 years from having ran. But if there was a criminal conviction and you were ordered to pay restitution, something that matter in a misdemeanor or a felony, it is 5 years after that payment's made.
Okay. Well, thank you. It's a wonderful work that you do, helping the population out in that. What are some of the obstacles that people face when re-entering the workforce, do you think, and continue with their work and recovery? Miranda, if you can go first on that one.
So I think some obstacles would be finding employment, maybe due to a participant's record, or not having transportation, or even transportation to get to meetings. There's also a barrier of not having resources in certain areas, or very scarce resources in certain areas in Kentucky. And I do know that in our facility, reentry, if a participant is serving out their sentence, they cannot link them up to halfway housing, transitional housing, or sober living. They have to wait until they get out and do those things themselves. So it's kind of, it's kind of hard to watch sometimes, but I think, that's why we're here.
And maybe create some seamless transitions from one until the other as they're transitioning outward. Stephanie?
Now, I would definitely say for the clients that I'm working with, transportation seems to be a major barrier on many levels, whether that's to be able to get to court or to be able to get to work. And then once they are able to get a job, just having the flexibility in employment that is needed for someone in long-term recovery to be able to make the meetings that they need to get to stay in recovery, and to be able to make court appearances for things like getting their records clear, or to get visitation rights to their kids. So having some job flexibility would be really nice, and being able to address transportation issues is a big concern.
Yeah, that is. So what the barriers you notice, what do you think are those next steps that we can do as a community or as an organization to engage and kind of make the change happen, where we can have more positive influence or processes in place for this? Miranda, you can go ahead.
I say that the next step for change would be finding more people to advocate for the people in the areas that have little resources, and to continue to fight and reduce recidivism and reduce stigma that has been placed on addiction and even those in recovery. And I think also it's hard for people to come across those resources that, you know, are in those scarce areas. So maybe finding ways to see if they're available to go to any other area that may be close to home, but not necessarily at home.
Thank you. Stephanie?
I sure wish I had an answer for the transportation issue, because it seems to be one that's plagued my clients for many years, for those in recovery and for those who haven't dealt with that challenge. But I think that Miranda's right, that stigma is a problem, but I think we're on the right path in that way with initiatives such as this one, just educating individuals throughout all the community partners and starting to, from my perspective, to educate the judicial system so that the judges understand what it means to be in long-term recovery and to work with those in recovery. I think it's real important too, as we see people exiting the system, that they're leaving incarceration, that they be linked up with the resources that they really need to be successful. And there are a lot of resources out there. They just need someone to tell them about them, and maybe they leave with literature so that they know about them and they have something they can, you know, refer back to, so that they reach out to individuals when they are out of the local detention centers.
Yeah, and programs like this and initiatives like this, where you're trying to decrease the stigma and increasing awareness, can kind of broaden the scope of more organizations being involved and more legal aspects being involved into decreasing those stigma and increasing that availability for connections to be made and facilitating sort of programs availability. So what do you think are people reluctant even to discuss the topic when it comes to helping individuals with substance use disorders or substance use issues? Miranda?
I'll say that I would remind people who are reluctant to think that, you know, people in recovery are people too. And what if this was someone that you love or someone that you know? Don't they deserve a chance to live a better life? Recovery is a process and it does take time, but it is also very unique because everyone does recover differently.
They do. Every person is an individual and their story is unique to themselves. Each person has a different experience and a different process that they go through. Stephanie?
Yeah, I would just echo the exact same thing, that it's important to point out to people that before they pass judgment, they need to walk a mile in that person's shoes and see things from their perspective and what they've been through, and to just be there to offer whatever kind of help that they're in the position to offer. And I'm hoping our judges come around to being more aligned in that kind of way. I mean, we have dealt with judges in the past who haven't been as open to people in recovery being able to reestablish relationships with their children and move forward. I can definitely say, though, I'm seeing a wonderful reaction from the judges that I deal with in my service area with the expungements. They are very happy to give these individuals a fresh start. And some of the judges even tell the clients how happy they are that they're here today and how proud they are of them, that they've made those steps in recovery and how well they're doing. So it does seem like there is a shift from my perspective here in the counties where I serve.
Yeah. And from the region, the western part of Kentucky, we've seen a shift in the kind of mindset of addressing substance use disorders and helping people in recovery, so that the conversation has been increasing. And I think with given past COVID and entering into post-COVID, I think it's broadening the scope of that conversation to be had in different areas. Miranda, do you think that funding resources are there for county jails to hire or utilize like peer supports and things like that?
So I know that for us, Voices of Hope, we have recovery coaches all over the state of Kentucky, inside jails, inside prisons, and in the community. And these programs are funded by the government. We help people all over recover inside Kentucky Department of Corrections, and supporting them and helping them to build recovery capital, which is building resources and having a backup plan with those resources in case if one falls through.
So what do you think are one of, and I'm going a little bit over a little bit, but so peer supports play an integral role, and we're hearing this across Kentucky. Do you believe that they have a substantial amount of experience or information that can provide a person in recovery with just a person to talk to?
Yes, and I think we are, you know, a good resource, because we do get it, and we have been in those shoes in some way, shape, or form. And there's nothing better than to have someone helping you that understands you, where you come from, or where they come from. Being able to compare that, but also find the difference in that. You know, we all recover differently, but we've all been in similar situations.
So what is a day like? What is a day in the life of a peer support?
So for me, I do smart recovery meetings with my participants. I share from experience. I get to be my most authentic self. That to me is just amazing. I get to be me and show up for my participants. I am a resource as well as a form of support for them that they may not have.
That's great. You live by lived experience, you have the opportunity to kind of share what you've been through, and maybe some of those experiences with the person that you're coming in contact with kind of mirror each other a little bit.
Absolutely, yes.
Yeah, makes it a broader way of kind of interacting, engages,
Yeah.
right? Yeah.
Yeah.
Working in corrections for so many years, I've come across various situations where individuals who are incarcerated are searching for a way to both rehabilitate and recover, and trying to gather kind of like that information or who they would go to for those kind of resources. Do you know of any resources in your area or in the community in general that people can reach out for?
So I know that we have reentry inside our prison and in the community, and as well working alongside of a recovery coach or peer support. We have meeting directories. We have inpatient and outpatient programs. We have halfway housing and support group meeting directories, transitional and sober living as well. And we also have access to jobs in the community that may be hiring, and felony friendly jobs as well.
Stephanie, do you know of any in your community that is friendly to recover, those in recovery, or resources that can be available to them?
Yeah, we definitely have employers who are friendly to recovery, and recently Kentucky River Foothills sponsored an expungement clinic in conjunction with Goodwill and invited employers to come out who were willing to give second chances. So I think they called them second chance employers who were looking for people to come work for them. I have to admit, I wasn't really knowledgeable about all the resources, so I reached out to one of the experts in our program that I'm happy to say works for us. And she's working one-on-one through the Project Renew grant that I talked about with those who are incarcerated and with those in recovery. And she shared with me several different resources. The first one being Goodwill. I talked about Goodwill helping so much with expungements, but they also help a lot with GEDs and education and helping people get transportation. That is one of the things I talked about, is that's a struggle for individuals. Goodwill is helping with that by providing bicycles and cars. So that is a bright shining spot in the lives of many people if they can get that help through Goodwill. Kentucky Adult Education is also a good resource for people in long-term recovery to be able to get that GED that they may need for employment. And I was told that the Kentucky Career Center is the place to start for those in long-term recovery, that they will help them look for employment and they will help them get connected with other opportunities and other resources that they're going to need, that they're very knowledgeable about resources. So it sounded to me as if we're going to give one place for someone in recovery to go to when they're no longer incarcerated is to please hook up with the Kentucky Career Center in terms of trying to find employment. And I was told for those who are incarcerated that it really depends on where they're incarcerated, that some of the local detention centers and longer term prisons are doing work for those incarcerated to help them get their GED while they're there, but others are not. So it just really depends on where they are. I understand some of them are doing job training and helping with interviewing skills prior to being released. So that's good. And it sounds like there's a lot of work going on before release and immediately after, if people in long-term recovery know where to hook up to the services. So it sounds like going to Voices of Hope is a great place to get started and get a peer support worker, and to go to the Kentucky Career Center. And don't forget Apple Red. Of course, I want to say that if you're in Kentucky, that I consider us a very valuable resource for helping with any legal needs that someone in recovery will have.
Have any of you participated in the reentry simulation event that DLC kind of puts out there in the different communities?
I haven't, but I have heard of it. I know exactly what you're talking about, but I haven't done it. They did do it one time here at our public library, but the date conflicted with something I had going on and I wasn't able to go. But I hear that it's a powerful experience.
Yeah. We're having one in Owensboro, September 22nd. So if you know anybody in the area that would like to participate, more than welcome to come on by. Miranda?
Yes, I have not either participated in that. However, I did just meet with my reentry coordinators today. It was really funny how that worked out. And they have invited me to join some of their classes to help our participants, maybe with Narcan training and MOUD, SANMAT. So.
The location for that in September, there's one in Somerset in September for the reentry simulation event. And if no one's aware of what that reentry simulation event is kind of having different organizations or different tables set up where a person who's been incarcerated is going back out into community, and it's kind of simulating their reentry back into the population and getting services or getting their medical card and just different elements throughout that process. So it shows them kind of like a little bit about what is being faced as they're transitioning out into your community. So participating in that is a great element. And it offers an opportunity to visualize that and kind of see and maybe notice what barriers exist. Maybe notice where you can streamline different things that can help them process different elements to get into a better space or get them the information needed. So we have a couple questions in the chat. That one of them is says, do you do anything in your work to reduce stigma around substance use disorder, such as using recovery-oriented terminology?
Yes, we do. We are constantly doing trainings for the evolving recovery community, and as well as Department of Corrections. I am always going to participate in anything that my participants participate in so that I can better understand what they need from me as a recovery coach.
Stephanie?
We don't do any sort of trainings or anything like that. That's just not really within the purview of what we do here at Legal Aid, but we certainly are using that type of language. I mean, we talk about people who are in recovery when we talk about the population and yeah, that sort of thing. we do attend the Celebrate Recovery events. We're happy to be part of those when they have them here locally and throughout Eastern Kentucky. We always enjoy hearing the power of a story, and I think that always brings what has happened to individuals into light, and it helps everyone who is present understand that what has happened to those individuals can really happen to anyone. And so we do participate in any way that we can, but we don't do any sort of trainings or anything like that.
Okay, we have another question for you, Stephanie, in reference to the expungement. They're indicating is 5 years. So evictions can be expunged. Is that 5 years after also? Can someone request multiple certificates from KSP, such as one now and one in the future? I think you addressed a little bit of that, but if you can go ahead and kind of explain that a little bit better.
Yeah, I can explain that. So for sure, you're not limited on the number of certificates that you can request. They do cost $40 each. But again, if you go to a Goodwill clinic, Goodwill expungement clinic, they're going to pay that $40 fee and order it. And that's whether you go one time or you go a couple of times. So what a lot of people will do is go to a Goodwill expungement clinic and have a certificate ordered if the attorney who meets with them believes that there is some type of charge that's going to be eligible. And then when the certificate comes back, the attorneys will take care of getting any dismissals off the record in any convictions that are eligible. And then the attorney can give advice to the client on when the other charges will be eligible to be expunged. And then when that time comes, a new certificate can be ordered. So there's no limit on that. It's just waiting for the certificate, which can take 2 to 3 months to get issued, depending on how many are being requested by KSP. But the process, once the certificate is ordered here in our counties, is really quick. I mean, I'll file petitions on a Monday, and by the Friday, the expungement orders are signed. So it's really fast once that certificate is in your hand. If I said evictions are eligible, then I certainly misspoke. Evictions are not criminal charges, and they are not eligible to be removed from your record at this time. Evictions are civil cases, so they do remain on the record. They don't come off when you get an expungement.
Okay. So also there was a mention here that Kentucky Career Center offers vocational rehab counseling and assisting disabilities, including substance use disorders, obtaining and training employment. The reentry simulation, also the Kentucky Career Center usually is involved in those. And there's one Friday, September 22nd, 10 to 2 o'clock. This one's in Owensboro. I know in the chat, somebody mentioned there was one in Somerset. But if you would like more information on at least the one in Owensboro, you can contact the Kentucky Career Center and they'll be able to provide you with more information on that. Let's see, I've got a couple more questions in the chat. I think you mentioned this already. Does Goodwill do clinics to help multiple certificate costs?
Yes, so I see that question as well, asking if you need a certificate for every charge. So no, one certificate is going to cover your entire criminal background in the state of Kentucky. It'll list every single thing that you've ever been charged with, whether it was dismissed, whether it was, you pled guilty to it, whether it was pled down. It's going to list all those details. So some people's certificates are a couple of pages and some people's certificates will go on for 10 pages, but the $140 fee will cover every single criminal charge for that individual. So they look it up by social security number, and Goodwill does pay for that $40 cost if you go to a clinic. And so like once someone is a client of mine and I help them expunge like 6 charges, and I say to them, in a year, this felony is going to be eligible to come off. We just have to wait to that time. Then they'll come back to me and Goodwill is happy to pay the $40 fee to order a new certificate. And then as well as pay the new fees. Goodwill no longer is limited to the number of fees they will pay for expungements. At one time it was limited to, I think, $600, but now they're willing to pay whatever is needed by the client in order to get a complete clean slate.
And that kind of shows a little bit about how organizations are looking at just as involved individuals in a broader scope and increasing the availability of resources for them. And and
Absolutely.
even more so for those in recovery. So that's a good way of looking at the conversation as being looked at and broadened out more.
Hey,
Right?
Kathleen, I'm gonna jump in for a second,
Sure.
because I also know that you have great experience in the field. And so a question I have for all three of you is, can you explain your pathway to your career in supporting people involved in the carceral system? So if I wanted to work in one of the careers that you're in now, like where do I start? Do I have to like get a certain type of education to do what you're doing? Any certain types of classes, and what kind of experience to get where you are today? And so, Caroline, if you could start by just explaining a little bit more about, you served 22 years in the Department of Corrections. So if you can share a little bit about that experience and how you got to where you are today, we would love that.
I used to tell the friended population that I was serving sentence with them because it's a 22-year sentence working for the Department of Corrections. But no, I started as a regular officer and just moved within the organization, within the agency. And my heart was really in helping people just get to recovery services, get to programs and things within the facility. There were many opportunities where education was an opportunity that they weren't aware of, and just creating the conversation as an officer to the offender population, just creating that conversation where you can say, hey, this is available, why don't you think about extending your education, getting your GED, getting into college courses. Maybe there's a training available that you can take within the carceral system that can help you while you're doing your time, can help you get into a place where when you go back out to your community, you're in a better place, or can get a job, or can get the family that you haven't seen in a long time, and create those connections once again. So as an officer, I just continue to move within the system and facilitate just different programming, and just offer the opportunity and the conversations to take place. As an officer, you're often seen as that security aspect, and as that person that you're just there to guard somebody, or just to facilitate certain things. But you're also there as a rehabilitative source. So if your functions within the environment of the incarcerated population can be that resource, where if there's a program out there in the community, or if there's an opportunity for that person to get to resources, why not give them the information? Why not have that positive conversation within the system? So as they're transitioning outward, they'll know where to go. They'll know who to contact. They'll know what's out there, because the majority of the time they don't know. They don't know the information, and even your staff as well may not know. So engaging that conversation, and that was a lot of conversations I had within the system to help facilitate some of that. And as I ended my 22 years of service with the Department of Corrections, I wanted to see something else that I can do to help impact individuals who are having a hard time, that weren't finding their footing, and helping towards that. So I started from the Department of Corrections. I worked and came to River Valley Behavioral Health. And I was able in this position to kind of use those opportunities that I had within working in the Department of Corrections and facilitating outward. So now I'm on the outside, helping those who are incarcerated, and helping our staff within the system be more aware of what resource and availability is out there, and that communication. So I would suggest anybody who's interested in looking at corrections as a pathway to working in corrections as a pathway, you can also be that officer, but also be that rehabilitative agent as well. You can use your position there to broaden the scope and decrease the stigma and increase that awareness. So when a person is asking you in a facility, and you're in the housing unit, and they're asking you, hey, what am I going to do with the rest of my life? What is this it for me? You can actually say, no, this isn't it for you. you have an opportunity. There's a program out there, in this community, there's such and such program. Maybe you want to think about getting into that. Maybe we can give you some resources and some information. So while you're sitting here doing your time and doing things, you can read about what this looks like. Or medical can provide that information to them if it's in that aspect as well. So I think increasing that awareness kind of brought me to where I'm at today. And I enjoy what I do. I get to talk to you all. I get to express and provide that information out there and maybe change the dynamics a little bit where we see incarcerated individuals who have substance use issues, not as an incarcerated individual with substance use issues, but just an individual who went through a tough time and who's looking to better themselves and get to the resources they need and live their productive life. That's the life that they want to choose to live, and just giving them the opportunity to do so. Because oftentimes we don't allow people to have that opportunity because we're so grounded in the fact that we see stigma all around it. It gets that negative view of things. But switching it over into a positive light can make a whole lot of difference for somebody who's looking to recover and isn't in that recovery process.
Thanks, Caroline. Also interested, Miranda, in how there might be a lot of people on this webinar who want to become a peer recovery specialist. How did you get into your role? And yeah, what was that process like for you?
So for me, I always knew that if I could get sober, I would be powerful enough to try to help someone. I'm very passionate about this because, I mean, I get to be me. I've never felt more at home than where I'm at now. I went through a training at Bridgehaven in Louisville, Kentucky, where I think it was 35 hours for the week for peer support training classes. And then 2 weeks after that, we tested. And she told me that my results wouldn't be back until like the next day. And she called me like within 10 minutes of me leaving there and told me I passed my test. It was like the most exciting thing ever. And I started looking for peer support jobs. And because I was already peer certified, Voices of Hope hired me. And the other training that was required of me before starting and Department of Corrections was to train as a recovery coach. That was another 30-hour training. It was done in a week at Voices of Hope. I'm very fortunate because they pay for your training there, and there are jobs out there that will do that. And I think that, we've had conversations in Department of Corrections about peer support being available to people who are incarcerated, to participants who are incarcerated. And if that's somewhere they want to go with a career path, they will have the resources to do that. I am always providing resources for peer support training in different areas of Kentucky. I mean, they even have them online now where you can do your classes online and test online. And there's a lot in different areas in Kentucky that you can train. Money may be a barrier for some people, but there are funds and grants that can pay for some of the classes depending on where they're at.
Thanks, Miranda. Yeah, in my past, I was a peer support specialist, and I actually had the opportunity to go into hospitals and emergency departments to work with people seeking recovery. So there's a lot of different settings that, if you want to be a peer recovery specialist, that you can work in. Miranda's the person that specializes in working in the carceral system, if you have any questions for her. Stephanie, do you want to explain how you got to where you are today and the process and education behind that?
Sure. So becoming an attorney does take a while. You graduate from high school and then you get a bachelor's degree. So that takes 4 years, and then you go to law school, which is another 3 years, and then you take the bar exam in the state that you want to practice law in. And hopefully you pass the first time. And if you pass, then you're admitted to the bar. Then you get a job as an attorney, and any attorney really would have the opportunity to work with those in recovery if they would choose to do so. But certainly in the legal aid community, we're committed to doing that, and we have a lot of opportunity to do that. So if there are any attorneys out there watching this webinar who are interested in doing this work, then we have some new positions here through Project Renew that we'd be happy to talk with you about.
That's excellent. Just being mindful of time, we have about 8 more minutes left. Another question I had, and Caroline, we'll start with you if you have any experience related to this. Can you talk about what allyship looks like for people who have been involved in the carceral system?
To me, allyship is that collaborative effort that where each organization is looking to help those who are in recovery or who are in the process of searching for that recovery process. It is that joint togetherness that we help decrease the stigma associated, and we increase the potential and the opportunity to access different elements to help that individual in their recovery, and unite with others across, whether it be your community or across the county or across the state, with that opportunity as well.
Miranda, do you have any experience around allyship while working in the carceral system?
Yes, I think I've been very fortunate with the staff at Voices of Hope, and then also staff at Department of Corrections. We do work together as a team. We do agree on harm reduction, and everyone recovers different, and they're people too, just like us. It is definitely a team effort to support these participants that are just doing the best that they can while they're incarcerated.
Thanks, Miranda. And lastly, you, Stephanie, do you have anything to add?
I would just say that, as I've said before, that we have this new grant here at Apple Red, and that other legal aid programs have as well. And I think there will be a lot of allyship that come out of that, from having a team of 3 attorneys, 3 paralegals working solely with those in recovery and trying to help them. I think they're going to have a huge impact to help that population.
Thank you. Awesome. We have one last question, then I'm going to put up my screen so you can see my email. If any of you want to answer this question, we kind of talked about stigma already. We know this is a big part of our campaign. Do you have any ideas how we can change the stigma associated with addiction and justice involved recovery? Miranda, do you have any ideas on that?
Yes. So I know that I have worked alongside some, employees that stigma, they didn't know any better. So just sharing your experience and how, how it's positive to be in recovery, and how, it is, I'm trying to think of the right word, I'm sorry. It's just, it's difficult. It's difficult for me to see sometimes, but I also know that, they're human too, and they don't understand. People that don't understand addiction will never understand. They just won't understand. Sorry, I'm probably not answering the question right.
You're all good. You've provided a lot of great information to us today. Stephanie, any ideas around combating stigma?
Just what I said earlier, if there could just be more and more opportunities for those in recovery who are willing to share their story, I think the best way to change attitudes and stigma is for people to realize that, like Miranda said, those in recovery are just people too. They've just traveled a different journey than those who are not in recovery. So I think every opportunity for individuals who are willing to share their story to share it is a great way to reduce stigma. So anytime there's trainings or anytime we're having these clinics or anything like that, if we could just take a few minutes to hear a story from someone, I think we could change attitudes one event at a time.
Yeah, it's exactly what we're trying to do every day is humanize people who have substance use disorder. And Caroline, I'll let you finish this off, and then I'm going to put up the screen so you can see my email if you have any questions or ways to get involved in our campaign.
Okay, well, my response to that is take it back to basics. Just treat every individual like you might want to be treated. Every individual is worth something. They are amazing individuals who at one point or another had something happen to them and they, it went that way, but it's basic human decency. Let's go back to that. And that'll help decrease the stigma and that'll decrease everything else. So thank you all for participating and thank you. It's been very interesting and reach out to your local community, find out what resources are available in your community. I'm guessing there's a whole list that you can get involved in. And if there isn't any, take up the mantle and start looking for that. I appreciate y'all today. Thank you so much.
Thank you, Caroline, for moderating. Thank you to our panelists and everyone who has attended our webinar. We hope you come to our next one in September. And my email is on here if you're interested in sharing your story, becoming a community-based organization, and partner with our campaign. Or if you just want more information, you can go to our website at unshamedky.org.